Welcome to the Policy Visibility Drive, a Ghana Health Service policy initiative created to enhance the exposure of policies, manuals and guidelines within the health sector. In this video, we shall be focusing on the policy and guidelines for hospital accident and emergency services in Ghana. An accident or an emergency is an injury or illness that is acute and poses an immediate risk to a person's life or long-term health. Accident and emergency patients present with potentially life-threatening symptoms such as a headache, chest pain, abdominal pain, collapse of unknown cause, and severe injury. Such patients have pressing needs and may present without prior appointment. They may also report to the unit on their own or by an ambulance. Policy statement. All health facilities shall provide accident and emergency services. The goal of this policy and guideline is to establish efficient and effective accident and emergency services to reduce disability, morbidity, and mortality in hospitals. A designated accident and emergency department or unit in health facilities operating 24/7 provides initial treatment for various life-threatening conditions without financial barriers. This unit utilizes a triage system, ensuring efficient patient care, and offers specialized emergency care equipped for rapid interventions. Specific requirements for accident and emergency units in hospitals and clinics, including triage and resuscitation areas, waiting spaces, and standard equipment, emphasize the need for diagnostic tools and essential medicines. The framework also outlines equipment and supplies necessary for effective accident and emergency functioning, promoting timely and quality emergency healthcare services. The accident and emergency units must be staffed by competent and dedicated healthcare professionals. National training programs shall be established for accident and emergency teams, focusing initially on hospital teams. Doctors and nurses shall undergo basic and advanced life support training, while other healthcare professionals shall receive basic life support training from accredited trainers in selected centers of excellence. Recertification is required every 3 years. Continuous professional development mandates recertification for core staff, and hospital management must ensure accident and emergency staff have training in emergency care. Core team members, including doctors and nurses, must be trained in various life support and trauma skills. The accident and emergency team, led by an emergency physician, shall include a range of specialists, and regular meetings and reviews are essential for ongoing clinical updates and quality assurance. If you've liked this video so far, give it a thumbs up and subscribe to the official YouTube channel of the Ghana Health Service. Comment down below as well to let us know what you think, and click the card above to watch all Policy Visibility Drive videos. All clinical and non-clinical staff of the Accident and Emergency Unit should adhere to the approved ethics of the profession. The utilization of the Accident and Emergency Unit involves a triage process, with patients assessed and attended to by a doctor based on protocols. Clinical decisions on patient disposition, whether transfer or discharge, are made by the attending physician. The accident and emergency admission policy admits patients triaged under red, orange, and yellow categories, while green triage patients are referred to general outpatient or appropriate health facilities. Internal consultations with specialists may be requested by the emergency doctor following established internal arrangements. Referrals to other hospitals must adhere to the Ministry of Health guidelines, with only the emergency physician or senior doctor having the authority to make such referrals. Patient dispositions from the emergency department include transfers, discharges with follow-up instructions, or cases of discharge against medical advice, which requires appropriate documentation. In the event of deaths in the accident and emergency unit, a thorough examination is conducted before declaring a patient brought in dead, and the coroner is notified by the accident and emergency team leader or a designated member. The accident and emergency unit should have links with other departments or units of the hospital, as well as pre-hospital emergency services and all relevant emergency service providers within the catchment area. It is important to collect data for the purposes of audit, monitoring, and evaluation for continuous quality improvement. The emergency folder should include all pertinent biomedical data, and the data collection tool for accident and emergency unit should be used for capturing the data. All persons in Ghana have the right to receive quality accident and emergency care. In conformity with the Ministry of Health policy, all accident and emergency patients should be attended to without requesting for money during the first 48 hours. Sources of finances for emergency services shall come from the following areas: Government of Ghana, National Health Insurance Authority, private health insurance, special taxes, example, emergency service tax, and vehicle insurance premium. The Accident and Emergency Unit shall conduct research as part of the organizational learning and continuous improvement activities. These guidelines should be reviewed every 5 years by the Ministry of Health. Please note, this video only contains an abridged version of the policy document or publication. To access the full document or for further reading, kindly visit the Ghana Health Service website at www.ghs.gov.gh. Thank you for your time and attention.